Specifically, the symptomology that the Borromean here is a little lack of energy and a whole host of different neurological problems that all stem from a poisoning from levaquin, which is a fluoride-based antibiotic. It's called a fluoroquinolone that I took when I was traveling in Bali, and I was given it with a NSAID, anti-inflammatory, and that allowed it to cross into my brain and do a lot of damage, which is kind of called Fluoroquinolone Toxicity syndrome, and that has its own host of issues. I suffer from visual snow from the poisoning, where like when I look at you, I see you over there for a split second.
What's that called? What does your doctor call that?
That's pollenopsia.
Okay.
And then the visual snow is kind of like a host grouping of all these different visual symptoms where pretty much the buffer in our brain isn't working, where I see static on the walls, I see my blood cells constantly, everything kind of smears. It makes it difficult, and it's a brain issue. So fluoroquinolone toxicity syndrome represents itself in a million different forms and ways, and some people early on had hypothesized that because fluoroquinolone toxicity syndrome damages the mitochondria, that NAD would be a really good way to help people that are dealing with energy problems like chronic fatigue, etc. I was kind of part of the original group of people that were floxies or fluoroquinolone people, and I did NAD for a week in Arizona. I had visual symptoms at the time that didn't change. However, I went from having like really no energy and being tired to getting a large level of recovery from the treatment. It felt great. I mean, I went from being, I'm a really active person, and then I was destroyed. I mean, I couldn't walk for 3 months. I had to move in with my mom. I was crippled, like I had like a GoFundMe on Facebook, like I couldn't go outside, like I was chemically sensitive. I still suffer constantly with lots of little things, but I mean, I went from like losing my life to getting it back. So I've come here to get some treatment too. It's a metabolism issue in the brain, so hopefully with the NAD get some improvement there, and also just an overall health and well-being.